in South Louisiana. Anyone who's got allergies, take this.
NAD is probably the biggest thing coming out right now on anti-aging. Normally, like when we're tight in here and you start getting that pressure and you're taking those joints and muscles through full range, this one feels almost addicting.
So consistency over intensity. And then we're just going to roll up and down. It seems crazy, but when you go get massages and they're finding tightness in here, the first thing you need to do is start releasing this stuff. Kelly, thank you. You did the exercises last week and it helped a lot.
Good day, my friends. Please let me know that you can hear me. My setup is a little bit different, as you might notice. So if y'all can say, yes, I hear you, everything's good. Otherwise, you're just looking at me talking. Welcome to another episode of Tea with Dr. D, where I basically come on and we collect questions that are dealing with health and healing and pain and all these different things. And we come on and just answer as many questions as we can. So if you do have any questions about health, about healing, about regenerative therapy, physical therapy, anything like that, even if it's not like that, I'm here to answer whatever I can for you. So I hope y'all are having a great day, and welcome. Yes, you can text me. You can text 801-691-7582, and I will answer that question. I will answer it. So that is me. So let's dive in. We can get a few questions. Hey, how are y'all? Welcome to the show. I know we had collected a number of questions. If you have a question, I am here for it. I will answer and do whatever I can to give you some good information. So let's see. Nathan, thanks for the question, man. I've been diagnosed with a torn rotator cuff. Is there anything I can do besides surgery? Of course. When we talk about this, I like to kind of explain a little bit of what we're talking about. So if you're listening to this later, you have a good idea. Rotator cuff tendons are the four muscles that attach to your shoulder, and they kind of surround the shoulder joint, which is why we call it the rotator cuff. So it creates a cuff around there. It stabilizes the shoulder a lot. When we don't have good tension or health in the rotator cuff, our shoulder tends to kind of move around in there and bang into things, the labrum being one, and create a lot of inflammation and a lot of pain. So this can be torn in a couple of ways. We see it everywhere from skiing, falls, and most of what we see now is kind of gradual wear over time, because right now we have this position where we're forward a lot and we tend to kind of cover the shoulder and we start banging in to the tendons around the rotator cuff. When we do that, that starts to wear away some of the tendon, creates inflammation. If it's really bad, of course, surgery does become an option, and that's something that we can kind of discuss case by case if we need to. But what we look at to decide that is like, what's the grade of the tear? How big is the tear? How deep is the tear? So we think of these as like across the tendon and through the tendon. How much of the tendon is torn and how deep into it is it torn? All of those kind of give you an idea of how much this can heal. Of course, a lot of people talk about physical therapy. When you're doing recovery exercises, you're stimulating the body to go in and repair the tendon cells. If it's early, if you're really healthy, your body will do that great. I get asked a lot about corticosteroid injections. They help reduce inflammation and they help pain right away, but they don't really promote healing at the tendon site. So just keep that in mind. My favorite thing that we see right now for rotator cuff tendon without surgery, for that to heal without surgery, is something we're calling activated peptide therapy. So a lot of you have heard about peptides. I know they're kind of all the rage right now, but if we're looking at peptides such as BPC 157 that a lot of people use for regenerative purposes, I think they go in and they just try and heal everything in your body. We need to direct them. So we need to activate those peptides. You need to do something that tells them where to go in your body. So for us, what we try and do is like do some needling, do some high intensity laser, do some targeted exercises to tell the body, here is exactly where we want you to send these peptides to regenerate the tendon. And we've seen really good improvements in tendon growth seen on before and after ultrasound imaging, where the tendon has regrown. In really severe cases that are non-surgical, you can get into like PRP and stem cell therapies. And then if all of that stuff doesn't fail, or all of that fails, then you would look at a surgical option. Certainly with a rotator cuff tendon tear, not something that you need to start with right now. So hopefully that helps. I would work through that kind of hierarchy, if you will. So can we just do some exercise, do some physical therapy, get some hands-on treatment? If there's still like a lot of pain there, if you can see where the injury's at on ultrasound imaging, go ahead and do some activated peptide with some ultrasound guidance. Find a practitioner who can do that, and then continue going up PRP, stem cell. If that stuff doesn't work, surgery might be on the table, but you're a long way away from that. So hopefully that helps, Nathan. Welcome to the show, everybody. Let me know if you have a question. Say hi. Make sure that you can hear me, please. But I hope y'all are doing great on this rainy Wednesday. It's Charlie. Hi, Charlie. How are you? I'm looking for nerve pain relief for MS. It's in my neck, trapped, and shoulders. First of all, I was talking about this documentary. I believe it's called Living Proof. I could be wrong on the name of it, but try and look it up. It's a documentary on a gentleman who started documenting his journey with MS. And I saw a thing yesterday that he had just run a half marathon over the weekend. He goes through, living day to day. He follows a very strict diet, a very strict exercise routine. It's a very inspiring documentary. It's a little maddening, Charlie, if you've watched it, on how much pushback he gets when he starts talking about his treatment options for MS. So not what you're asking, but it's certainly worth a watch. And when we're talking about nerve pain relief in this situation, so this is a little bit different. MS is an autoimmune disease, to kind of catch everybody up. It attacks the central nervous system. So when it creates nerve pain, it's doing a lot in terms of disrupting the nerve signal, and that's where our pain comes from. This can lead to like some numbness, certainly pain. When we're managing nerve pain in MS, we're trying to reduce inflammation. We're trying to improve the nerve function, and of course, like improve our quality of life. So I know this question was specifically in regards to like dry needling. I do think a light form of dry needling might be effective in your case when we're treating all of the nerve distributions that you're having pain with. Certainly you could, I'm sure you've talked to doctors about doing some version of medical management. I've heard of, a lot of the neuropathic pain treatments, whether that be GABA or, baclofen, any of those things might be an option. One thing that has really good data on this in combination with treatment is something called PEA, palmitoyl ethanolamide. That's why we call it PEA, everybody. So PEA, Charlie, is a supplement that you can get over the counter that has the ability to reduce inflammation in the nerve. Very, very helpful, and it does it in a really neat way. It modulates the endocannabinoid system, reducing neuroinflammation, so specifically nerve inflammation. That is a really cool supplement. There's quite a few studies that were done in MS that show promising results, where it improves the inflammation in the nerves, kind of calms the symptoms down. So, of course, this is something that you would add on to your regular medical management. Make sure you're talking to your doctors and all that stuff. Another thing that I've seen studies on is NAD. NAD helps with cell energy production and repair. There are some studies that show it helps with nerve regeneration and reducing inflammation. So that stack might be a really powerful thing in combination with treatment. certainly dry needling could be a thing. I would get great hands-on care. Find a really good physical therapist. Find a really good stretch therapist. Make sure you're keeping everything moving how it's supposed to, joints, muscles, soft tissue, all of that stuff, and get on a really regular, consistent routine of exercise and stretching. So those things work really well. I've seen that improve a lot of these cases. Certainly when you kind of put everything together, it can create a really powerful effect. So I hope that gives you at least a little bit of direction. Keep going. There's a lot out there that we're continuing to see that can be changed and improved in MS related pain. So good luck, Charlie. I hope that helps you. What else we got? Kelly Ann, what brand of PEA and milligram do you suggest for fibromyalgia? I assume fibro is fibromyalgia. So if we are looking at just kind of general stuff, so PEA, very helpful in specific nerve pain. If we're looking at fibromyalgia and like the pain from that, you would look at studies that would tell you anywhere from probably 300 to 1200 milligrams. We try to start most of our nerve inflammatory cases at around 600 milligrams per day. And sometimes we'll try and like stack that. If people have a lot of nerve pain at the beginning of the day, they'll take it all at that point. If they have it kind of at the end of the day, that will backload that 600 milligrams. Just know that there are studies that show that it is certainly safe and effective in severe cases up to 1200 milligrams. What brand? We've used a number of them. We've used some from Life Extension, and we've added a more potent brand. We'll drop a link in the comments here that we've started using in the clinic. That's a very, very clean and powerful version of PEA. In severe cases, we've used that one lately and gotten really good results with it. We can drop a link for you and get that information over to you. It's a really good compound. I wish more people knew about it. If y'all are on here, you probably have heard me talk about how PEA can help in a lot of ways with nerve function, if you will, nerve inflammation. And there's not many things that do that actually reduce inflammation in the nerve. So take that for a couple weeks. I'd say if you're having significant fibro flare up, start at 600. And then you may experiment with dropping down to 300 milligrams. PEA tends to be a really good antioxidant if taken long term. No downsides that we know of. Doesn't seem to have any side effects or anything like that. So there could be a maintenance dose in there where 300 milligrams is what you stick with, and 600 to 1200 milligrams is what you do whenever you're kind of going through an inflammatory response. So I hope that helps, Kelly. Shishi, how are you, Shishi? How long can you take PEA and for what dose? So like I was saying, we don't have an end to it. There doesn't seem to be a point where it stops being effective. Most of the studies on like sciatic nerve, carpal tunnel inflammation show that within 2 or 3 weeks at the 600 to 1200 milligrams, most people are experiencing about a 50% reduction in nerve pain. So really, really helpful in that. What we see is that it continues to improve up to about 6 or 8 weeks. And then a lot of time at that point, if it's continuing to improve, we'll stick with it. Depends on what nerve and how much inflammation has been there. But in general, what we'll tell patients, if they have like a specific injury that inflamed the nerve, take it for 1 to 2 months until your symptoms are gone, come off of it. If it was just that nerve got inflamed and it goes away, you will be good to go. If you still have something there that's irritating the nerve, you'll find out really quickly because the nerve pain will be gone. You'll start moving around again, and over the next month, some of that will come back on. Don't take that as a bad thing. Get the nerve pain back under control, but make sure you're finding out why you're having nerve inflammation in that case. But start at about the 1 to 2 month range, Shishi, and that'll do you some really good improvements in reducing nerve inflammation. So hope that helps. Hey, everybody, thanks for jumping in. I see y'all. Say hi, drop a comment, let me know what you got, what questions y'all got. But what else we got in here? Island Highlands. I hope you're in the islands. Do you use Katsu therapy in your office? We do use Katsu therapy in our office. Love it. We were one of the first companies in Louisiana, I think in the States. This was back in 2015. We've been using Katsu therapy for a decade in our practice, which is crazy to see what it has done and continue to grow. If y'all don't know, Katsu therapy is a blood flow modification therapy that uses smart blood pressure bands that modify the delivery of oxygen to your muscles as you work them. I know that sounds kind of scary, but it's not. What it does is makes your body think that you've worked out really hard. Even if you're only lifting like 5 pounds and you do a bunch of reps, your body thinks that you worked out to muscle failure, and it releases all this growth hormone so it can go in and grow your muscle and repair everything in there, even though you didn't stress the tissues by lifting heavy weights. If you see this in like the bodybuilding world where they're trying to use it to improve, as soon as I saw it, I was like, that is for someone recovering who can't work out so hard that they can push enough to grow that muscle. They need another way to get the muscle to rebound. So all of our post-op patients, anybody coming off of like a joint injury where we really don't want to stress the tissue, but we want all the muscle to come back, we use Katsu therapy in every one of those cases. And again, yeah, we've been using it for a decade. So love it. Absolutely. Highly recommend it. They're great people. We've had Stephen Muñatones on the podcast a couple of times. You can go listen to those episodes about the science behind it. It's very neat the way that this whole thing came about and what it can do for people. So love it. Yeah, we've been using it for a decade. Jason, how are you, my man? I hope you're doing well. I've heard methylene blue increases the benefits of blue light up to five times. So I've been on a big methylene blue kick lately, and we do have some forms of methylene blue that we use for our patients. So methylene blue has been studied for its effect on mitochondria function. So it helps the body to improve electron transport efficiency so that your mitochondria work better. Red light increases mitochondria ATP production. So they both are getting your mitochondria to work better, just kind of from slightly different angles. So there's been a few studies where they looked at combining methylene blue with red light therapy to see if it enhanced the cell repair and inflammatory response. There was a study, I want to say like 3 or 4 years ago. It's in like the photobiomodulation. So if you look up methylene blue and red light therapy, it'll pop up. I'll get them. We'll drop a link on this video. So just pop back, give me a day or so. But what they found was that it definitely enhanced the benefits of both. They like fed off of each other really well, more than each one on their own. So there was some compounding effect of like improving cell repair, reducing inflammation, certainly improving the function of the mitochondria. 5x, I don't know. I feel like that might be a guess. I don't know where that number came from. I know that they work very synergistically. And actually, so there was I'm going to stay on this one for a second. There was a study, now that I'm talking this through, that used like infrared, so like photobiomodulation, infrared light therapy in MS cases. This is going to tie a couple of these questions together. In MS cases to reduce the inflammation at the nerves, while the disease was active. And what they found was that it improved significantly the inflammation and the pain in MS. So if we look at that, and I want to say that study was done, I know I'm dropping a bunch of these. I'll have to link to you. That study was done in the last few years, and they definitely found positive effects of using photobiomodulation, infrared, red light therapy in MS cases for inflammation and immune cell function. So if we looked at something like that, Charlie, I'm going to jump back to you for a second, and we were really trying to attack this, there would be potential to say, I'm going to do some version of methylene blue with infrared photobiomodulation, light therapy, red light therapy, and PEA, and kind of put these things together while I'm in treatment to improve my symptoms. I think, look, anytime you're dealing with those things, make sure you have a practitioner who's looking at all these things. But if you're kind of coming at a very advanced treatment option for something like that, if you combine methylene blue with the benefits of red light, which we have proof that laser therapy helps with MS symptoms, and we have proof that methylene blue improves laser therapy, like, can we stack those together and really create a very powerful treatment option? I think that's available. I think that's out there now. So that's where I would go. I don't know that that's 5X, Jason. I would say yes. If you're doing like regular red light therapy, do it. Add methylene blue. It does turn your mouth blue if you're doing the little troches. We have some high power ones that are these little squares that you just swallow. Yes, you will see some changes. Urine might be blue the first time that you do it, but all that passes through you. This is medical grade methylene blue. Troscriptions, for those of y'all watching this, does some really good stuff. Dr. Scott Schur over there is a brilliant doctor who we've worked with and known for many years. TRO Troscriptions, great company. I use them. If y'all have ever looked at some of my old videos and y'all see me with like blue teeth, probably because I had like one of the little methylene blue tablets in there, but really, really good stuff. So, well, while I've got y'all here, it is my lovely wife, Sarah's birthday. So please tell Sarah happy birthday. Wish her a great birthday. I won't say how old she's turning, but tell her that this is a great milestone and she'll live very healthy if she's doing all the things that we talk about. If we don't have any other questions, anybody got a question? Going once, going twice? No. Yes. Please shoot us a text, submit your questions, whatever you got. I'm here for y'all. Last Wednesday of the month, every month, even if it's on Sarah's birthday. So y'all have a great day, and I will see y'all in a month. If not, check out the Pain and Performance podcast. We've got some great episodes coming up, and we're going to continue to get as much quality information out there to y'all as we can. So have a great day, everybody. Good evening.